Welcome back to Higher Insights. As you know, today we are talking about spinal decompression with our guest, Dr. Stephen Shoshany. Now, at present, we see on the market a lot of things that actually talk about spinal decompression instruments that you can use at home, equipment that you can use at home, etc., etc. Do these have any value?
It's funny that you asked that, because I had an email from a lady in Australia. You know, she went to a doctor that does spinal decompression, and, you know, with this economy, everyone's trying to save a buck.
Right.
I don't think healthcare is an area that you could chintz and be cheap.
I know you can't.
You know, especially in my practice, we utilize top of the market, the best equipment out there. So I have them all. I have the DRX 9000. I also have an inversion table in my office, and this is the treatment that people think. It's a teeter inversion table. Will it do the same thing as a DRX 9000? Absolutely not. It's kind of comparing like a home video camera versus a professional studio. It can get the job done, but it's not the same thing. Mm-hmm. So when you have a doctor that's trained in spinal decompression and a machine that is designed specifically to do that, these machines are, you know, $100,000, where home therapy is maybe $200-300. It can't do the same thing. Can it hurt you? Probably not. Is it going to give you the same outcome? I don't think so.
What about those inversion things that people hang upside down with?
Inversion. I mean, I have one of those in my office. I like them, but if you're physically fit and you can get on it, by all means, but it's not going to give you any permanent change to the disc. While you're being inverted or in an anti-gravity position, it will definitely alleviate the pressure off the nerve in the disc, but it's not creating this suction. What happens with spinal decompression, it makes it different than anything else, is it pulls and then it lets go nice and slow, and pulls again, lets go, and this creates a suction or a vacuum which draws the nuclear material back. These inversion tables or traction tables don't do the same thing, because it's a static pull and it's just holding it.
That's right.
If there was a way that somebody could get underneath you and for 30 minutes pull and let go, and what's nice about the DRX and all these higher end decompression machines is it's a controlled environment. If you're using 60 pounds, it's 60 pounds the whole time. It lets it go 25%. So it's very controlled, very monitored. The patient is in control the whole time. So if there's ever any problem, they could push a button and stop it. So inversion is nice, but it's not going to do the same thing.
No, but it can help prevent some of the problems.
Yeah, maybe. I mean, I use it every day. You know, That's how I do my abdominal exercises. So it's not a bad thing.
No, okay. Now, what happens when the person comes into your office and so on? Do they go through, is there a way of determining what is happening to the spine? Is it x-rays or what?
Well, in our office we have a digital imaging system, so we're using a high-speed x-ray system to see the alignment of their spine. We're also using a digital gait analysis, so we're seeing the way they walk. A lot of times, you know, it starts from the feet and works its way up, so we do that. If they come in seeking spinal decompression, usually they come in with their own MRIs or CAT scans, and we'll go over those, and we'll determine whether or not they're a candidate for the procedure. Mm-hmm. People that are candidates for spinal decompression have to understand that it's not a 1, 2, 3 thing. It definitely requires a commitment of time and energy. You're in the office for at least an hour a day. It's a lot of work.
Yeah, I think that's one of the things that people quite often don't understand. It takes a commitment of time, like any form of healing.
Right.
And it's not that they come, oh, here, fix me.
People want a quick fix, especially here in New York. But, you know, quick fix doesn't really work. I mean, sometimes a surgery is necessary, and that's a quick fix. But 2 to 3 years later, the problem comes back at a disc above or disc below. I see it every day. Right. People that go get a microdiscectomy of a disc, and then they're pain-free for 2 years, and then, bam, they bend the wrong way, and they're back is hurting again, and they want to avoid another surgery.
Because also maybe the core of the problem has not been eliminated.
The core hasn't been eliminated, and that's why they have a name. It's called a failed back surgery syndrome, FBS. They say 60% of surgeries within 2 to 3 years, the pain comes back. Maybe not at the disc, but the disc above. When people have that come up, they don't want to rush out and get another surgery. They find out about this program, they come in, and they wish someone would have told them about it prior to having an operation.
Yeah. No. Let me ask you something. Can wearing the wrong shoes also cause a spinal problem?
Absolutely. That's why one of the things I do is I look at the way they walk. Right. I look at the way their wear on the bottom of their shoes are. So if someone has too much wear on the outside of the shoes, it could indicate either pronation or supination, which is an altered gait pattern. That needs to be addressed.